A 38-year-old woman comes to the office to discuss motion sickness. She is currently feeling well. The patient is planning a vacation cruise and has previously experienced severe nausea and vomiting while sailing. Immediately, just after reading these two lines, you should have a crystal clear picture of what we are talking about: vomiting, anti-emetic drugs, right? Four children pass medical notable only for a tubal ligation. Okay, the patient does not smoke and drinks only moderate. She is currently not taking physical examination including otologic, audiologic, and normal after. Which of the following side effects? So, perception of motion and orientation determined by input from the vestibular, visual, and somatosensory systems. These three systems are usually congruent, but in conflicting input can lead to motion sickness, which is characterized by nausea, dizziness, and autonomic symptoms like diaphoresis, sweating, all of that. Integration of these sensory pathways occur in the vestibular nuclei via muscarinic and histaminic neurotransmitters. As such, anti-muscarinic agents like scopolamine and first generation antihistaminics like diphenhydramine, dimenhydrinate, promethazine, meclizine, doxylamine. Doxylamine, I don't think so is a first generation. Just let me know in the comment section. Scopolamine in antimuscarinic. So muscarinic, antimuscarinic, antihistaminic. They are most effective for the management of motion sickness. And anticholinergic side effects are common with these medications, which can include dhatura, dry, hot skin, dry mouth, difficulty in swallowing and speaking, hypotension, accommodation paralysis, tremors, urinary retention, and constipation, respiratory depression, and ataxia can also occur. All these are side effects of atropine, which is obtained from the Atropa belladonna plant. Okay, then let us just quickly revise some anti-emetic drugs. First, I'll be talking about the drug class, then I will be discussing some examples, and finally, I'll be ending my discussion with telling you the clinical uses. First of all, the first class which we studied, anti-muscarinic. Examples here, scopolamine I told you only. Clinical uses, motion sickness, and also in pregnancy a condition known as hyperemesis gravidarum. Hyperemesis gravidarum, but in that promethazine is used. Then antihistaminics, I already told you, diphenhydramine, meclizine, promethazine. Okay, promethazine is preferred in hyperemesis gravidarum. This you need to remember. This can come as an MCQ for your USMLE PLAB NEET PG. Then dopamine receptor antagonist. The drugs here are chlorpromazine, also very commonly known as Temitil in this part of the world. For you people living in India, chlorpromazine and metoclopramide. So they act peripherally. Metoclopramide, I think so, is centrally acting. Domperidone is acting peripherally. Let me know in the comment section. So dopamine receptor antagonists, I'll be telling the uses of them together because all of them go hand in hand. Serotonin, you all know, 5-HT3 receptor antagonist, ondansetron, granisetron, palonosetron. These are the drugs of choice for, just be telling you in a short while. And neurokinin 1 receptor antagonists like aprepitant or fosaprepitant. So the uses of all these three categories is chemotherapy induced emesis. Chemotherapy induced emesis. Like cancer drugs. Cisplatin. Cisplatin is highly emetogenic. You need to remember this. Which drug is highly emetogenic? The answer is cisplatin. The most highly emetogenic anti-cancer drug. Fine. Then choices. Cough, diarrhea, like I told you, they are anticholinergics, right? So, cough, frequent urination and nasal congestion are characteristic of stimulation. This is characteristic of stimulation rather than blockade of muscarinic pathway. When you block muscarinic, you get dhatura. So cough, frequent urination and nasal congestion. Nasal congestion occurs due to extreme vasodilatation. Suppose this is the nasal septum. Fine. And this is the normal blood vessels. Fine. When you stimulate this, what happens? There is dilatation of the blood vessels. That is why we give oxymetazoline, xylometazoline, which reduce this. Vasodilatation leads to nasal congestion. Okay. Then choice B. Diarrhea may be seen with dopamine receptor antagonist. Yeah, metoclopramide can be a cause of diarrhea, but they are used primarily for diabetic gastroparesis. Diabetic gastroparesis. Paresis means weakness. That is weakness in the stomach. Paralysis is total weakness. Total, the limb cannot be picked up. But paresis is slight weakness. They are used generally for diabetic gastroparesis rather than vestibular nausea. You must know the uses. Dry mouth is the only correct option here.